Hello class. In this session, we're going to be talking about muscular flexibility. That is chapter 8 of the course textbook. Let's begin. Learning objectives. By the end of this module, you should be able to explain the importance of muscular flexibility to adequate fitness, identify the factors that affect muscular flexibility, explain the health fitness benefit of stretching, become familiar with a battery of tests to assess overall body flexibility, interpret flexibility test results according to health fitness and physical fitness standards, learn the principles that govern development of muscular flexibility, list some exercises that may cause injury, become familiar with a program for preventing and rehabilitating low back pain, and create your own personal flexibility program. The benefits of good flexibility. Why is flexibility important? I think that before we answer that question, we must define muscular flexibility. Muscular flexibility refers to the ability of muscles and their surrounding tissues, tendons, ligaments, and fascia, to stretch and elongate without pain or discomfort, and to move through its full range of motion at a joint or group of joints. The benefits of glute flexibility include maintaining healthy muscles and joints, improving mental health, relieving or reducing muscle cramps, improving posture and preventing low back pain, and relieving chronic pain. What factors affect flexibility? One of the main factors affecting flexibility is joint structure, the hinge joint or the ball socket joint. These are the different types of joints. For example, your elbow is a hinge joint. On the contrary, your shoulder or hips are considered ball and socket joints because of the location and placement of the joint and the ability to move in a specific range of motion. Flexibility is also affected by fat tissue in the body, as well as muscular elasticity. Body temperature also affects muscular flexibility. The warmer your body temperature, the more flexibility. Age, children tend to be more flexible than older adults. Gender also affects flexibility, with females usually being more flexible than males. And the level of physical activity can also be a determining factor in the flexibility level of an individual. The more physically active you are, the more flexible. Assessing flexibility. There are various tests to assess flexibility, but the number one or gold standard test to assess muscular flexibility is the sit and reach test. And you will have an example of the sit and reach test in the supplemental resources section of the module. There is also the total body rotation test, the shoulder rotation test. It is recommended that individuals take all three tests for a complete flexibility profile. Developing muscular flexibility. There are different types of stretching exercises, and usually muscular flexibility is improved through stretching and stretching exercises. There are static stretches, which are stretches that have little pain and low risk for injury. Usually, during static stretches, the individual is not moving. It is the typical stretches you see in warm-up activities. Then we have ballistic stretches. These are least recommended because they're explosive and may lead to sudden injuries because of their explosive nature. There's dynamic stretches that use speed of movement and momentum, And then we have proprioceptive neuromuscular facilitation, or PNF, stretching, which requires the assistance of another person. Sometimes you have seen professional sports and you see athletes receiving stretching from a trainer. That is an example of PNF in action. The body's response to stretching. There are two sensory organs or proprioceptors that protect muscles from injury during stretching: the muscle spindles and the Golgi tendon. We also have what is called stretch reflex. Most of us, at the moment we're born, we come with a number of reflexes that are designed to help us be protected and basically survive our environment. But we grow out of them as we get older. When should I stretch? It depends. However, it is recommended that the best time to stretch is usually right after aerobic or strength training exercises when muscles are warm, because you're gonna have more flexibility. The warmer your body temperature, the more likely that you're gonna have greater flexibility. So higher body temperatures are good for flexibility. It is recommended that you always warm up before you engage in any type of exercise, including stretching. And there's some sport specific stretches. For example, it is recommended that somebody stretching prior a sport activity does not stretch for more than 10 seconds per stretch exercise, because you're trying to activate your muscles. Anytime you spend more than 30 seconds in any given stretch, you are relaxing your muscles. Incorporating exercises for flexibility. Here are a list of contraindicated flexibility exercises, meaning these are exercises that are prone to lead to injuries, and therefore they are not recommended or contraindicated for people to do. However, we see a lot of people doing them, many times because they're not familiar, that they're not recommended, but it can show you exactly the reason why they're not advisable, because they put stress on specific body parts that are prone to injury, but they're also alternative. So you can see this on your course textbook. Preventing and rehabilitating low back pain. There are many causes of low back pain. The number one is physical inactivity. Basically, your body is not fit, and therefore spending too much time sitting is creating body imbalances that, because of the physical inactivity, it leads to pain. Poor postural habits and body mechanics, again, spending too much time sitting leads to back pain. Excessive body weight, strain and sprain injury to muscle and tissue, and psychological stress. Prevention and treatment through physical exercise is considered the best medicine for low back pain. When you go to a chiropractor and they do some, spinal treatment, they often refer you to do stretch exercises. The reason why they engage you in stretch exercises is because stretching, it's good for back pain. When to see a doctor for low back pain. It is always very important to consult your medical provider or physician if any of the following conditions are present. Whenever you experience numbness in the legs, or you have trouble urinating, or you have leg weakness, unintentional weight loss, or persistent severe pain even at rest. When you cannot sleep because of the back pain, that's an indication you need to go see a medical provider. There are different treatment options for low back pain. Again, it is always important to seek medical attention in extreme pain, but there is pain medication, exercise therapy, stretching exercises, core strengthening exercises, yoga exercises, spinal manipulation, which is usually what you get from a chiropractor, and in more serious situations, surgery. Creating your own flexibility and low back conditioning program. You want to incorporate stretching and strengthening exercises as much as possible, 2 to 3 times per week. Use proper lifting and carrying techniques. Perform the pelvic tilt exercise. Do not overload your back muscles. You want to avoid sudden torques, twists, or movements, specifically if you're not an active person. Keep your head and neck in a straight line over your spine. This is very challenging today when people are spending so much time in a computer or looking at their cell phones. But as much as you can, keep your head and neck straight. And see a doctor if your pain persists. In summary, flexibility is the achievable range of motion at a joint or group of joints without causing injury. Some musculoskeletal problems and injuries are related to a lack of flexibility. Participating in a regular stretching program where joints are moved beyond the accustomed range of motion maintains muscle and joint health. Factors that affect one's flexibility include joint structure, adipose tissue or fat tissue in the body, muscular elasticity and genetics, body temperature, age, gender, and levels of physical activity. The FIT-BP principles of frequency, intensity, time, repetitions, type, volume, and pattern of exercise can also be applied to flexibility programs. Flexibility exercises should be conducted a minimum of 2 to 3 times per week, with stretching daily yielding the most effective results. After 6 to 8 weeks of almost daily stretching, flexibility can be maintained with 2 or 3 sessions per week. The best time to stretch is generally after aerobic or strength training exercise, when muscles are warm. The most common reason for low back pain is lack of physical activity in the first place. And a major contributor to back pain is excessive sitting, which causes back muscles to shorten, stiffen, and weaken.